Mars won't be empty because of radiation or rocket failures. It will be empty because Earth ran out of people willing to leave, and then ran out of people at all. Every Mars colonization plan ever written begins with a supply line: rockets, fuel, technology, money, and ends with the one resource nobody modeled: people. Not people in the abstract, specific people, young, healthy, educated, reproductively viable, in large enough numbers to sustain a civilization from scratch. The plan to save humanity by colonizing Mars requires at minimum enough people to fill a small provincial city, somewhere between 10,000 and 40,000 people, every single one of them young, healthy, educated, and reproductively viable. That's not a guess. That's the lower limit biologists agree on for a genetically stable, self-sustaining population. 40,000 people sounds manageable. Earth has 8 billion. Every country with the technology to build a Mars rocket already has a birth rate below the level needed to keep its own population stable. The people required for the colony are the same people those countries can no longer afford to lose. That's the version of this story most people know. Here's the version that actually matters. Falling birth rates are a headline, a number that appears in policy reports and demographic projections. The problem sounds administrative, like something governments can address with tax credits, parental leave policies, and childcare subsidies. It sounds like a policy failure. It isn't. It's a biological signal at civilizational scale. And once the signal starts, no government program in recorded history has reversed it. Think of a nation's population like a company. Each generation is the workforce. When a company loses more employees than it hires every single year permanently, the company doesn't gradually adjust. It runs out of people to do the work. The most spacefaring nations on Earth have been running that deficit for 20 to 30 years. Each generation of potential colonists is smaller than the one before. The pool of 40,000 is already shrinking before a single candidate is screened. Birth rates in spacefaring nations drop below the level needed to replace the population, which means each generation is smaller than the last. Not dramatically, not catastrophically in any single year, quietly, like a tide going out. The cohort of 25 to 35-year-olds, the age bracket from which astronauts, engineers, and colonists are drawn, shrinks, not just in absolute numbers, but relative to every other demographic. For every young, healthy person available for a Mars program, there are now 3 or 4 older citizens who need medical infrastructure, pension support, and social services. That imbalance reaches governments before it reaches space agencies. A government facing an aging population and a shrinking workforce cannot politically justify exporting its youngest, healthiest, most educated citizens to another planet. Every person selected for a Mars mission is a doctor, engineer, or scientist who will not pay taxes into the system that's already underfunded, will not staff a hospital that's already short of staff, will not raise children in a country already below replacement rate. The political will to fund colonization doesn't collapse because the technology fails. It collapses because the electorate is in its early 60s and needs hip replacements, not rocket launches. Space programs are funded by political consensus. Political consensus reflects the median voter, and the median voter in every spacefaring nation on Earth is older than at any point in recorded history. You are 32 years old, the age NASA considers prime for long-duration missions. The country that trained you has more people over 65 than under 20. Your government is deciding right now whether it can afford to send you, whether it can afford to have you not come back. The biological barrier on Mars then compounds every political failure that preceded it. Mars' gravity is roughly 1/3 of Earth's, which means your body, over months, begins reading the environment as permanent. Your skeleton was built to carry your weight upright against Earth's pull. In 1/3 gravity, the signals that maintain bone density drop off. Muscles designed to support you stop supporting you. Bones built to carry you upright start becoming something lighter, more fragile, more like what you'd need if you were never going to carry your own weight again. You don't feel it happening. That's the part that should frighten you. You feel fine. You're working, building, operating. Meanwhile, your body is quietly renegotiating the contract it had with Earth gravity, and Mars is signing new terms you didn't agree to. But the reproductive system is where the numbers become brutal, and the colony's future ends before it begins. Studies on rodents in low-gravity environments, the closest documented data available, show pregnancy failures, miscarriages, and developmental problems at rates that would end a colony's self-sufficiency within one generation. The fetuses that do survive show skeletal and neurological differences consistent with development in an environment the human genome was never selected for. Mars gravity is not a variation, it is a fundamentally different condition. If the colony cannot reproduce on Mars, it is not a colony, it is a hospice with a launch window. The first generation arrives, builds the habitat, begins operations, and then the second generation, the children who were supposed to make Mars self-sustaining, either cannot be born safely or are born with differences that make them dependent on medical support that Mars cannot yet provide. The colony now requires continuous resupply of both materials and people from Earth. But Earth's birth rate has continued to fall. The supply line isn't just expensive, it's demographically impossible. That is the point of no return, not a single catastrophic failure, but the quiet arithmetic of a civilization that can no longer replace what it sends away. Picture an empty maternity ward, rows of beds, no one in them, the equipment still blinking. That is not a metaphor. In parts of Japan, South Korea, and Southern Europe, maternity wards have already been converted to geriatric care. The rooms exist, the beds exist, the patients do not. So the viewer sitting with this information will think of an obvious fix. You freeze embryos, you bring genetic material instead of bodies. You reproduce on Mars using carefully managed pregnancies once the colony is established, or you use artificial wombs, technology that removes the biological risk from the equation entirely. The idea is not wrong. Cryopreserved embryos are a real technology. Genetic diversity can, in theory, be maintained with a smaller physical population if you carry enough frozen genetic material. The first step is correct. Here is where the second step breaks. Artificial wombs, at the scale required to gestate children from fertilization to birth without a full medical team, without a hospital-grade power supply, without neonatal intensive care infrastructure, do not exist. The technology that exists today can sustain a premature infant already gestated past viability in a hospital equipped with specialists and redundant power. It cannot gestate a child from the beginning independently on a planet where a power failure kills everything in the habitat. Mars cannot guarantee the power supply. It cannot guarantee the sterile environment. It cannot guarantee the dozens of specialists required when something goes wrong, and in early-stage medicine, something always goes wrong. But even if the technology existed tomorrow, you have now added to the colonists' requirements obstetricians, neonatologists, pediatricians, genetic counselors. Every solution that adds medical complexity to the colony adds to the staffing requirement, which adds to the demographic pressure on Earth, which makes the original problem worse. You haven't solved the supply problem, you've extended it by one generation and made it more expensive. The colony that depends on artificial reproduction is not a backup for humanity. It is a research station that requires the continuous output of a civilization that itself running out of the human and economic resources to sustain it. You are not building a lifeboat. You are building a second ship that draws from the same sinking harbor. There is a documented real-world precedent for exactly this failure, and it happened not in space, but on Earth. In the 1980s, Japan's birth rate began falling below the level needed to replace its population. The government recognized the problem early. It funded programs, adjusted immigration policy, subsidized childcare. Japanese economists, demographers, and policymakers understood that the numbers were going the wrong way. They understood that economic pressure, the cost of raising children in urban environments, the demands on women entering the workforce, the structural incentives that made large families impractical, was driving the decline. What Japan knew, the numbers were wrong and economic causes were driving them. What Japan didn't know, that a trend once established across an entire industrial economy does not reverse. Not because the programs were poorly designed, because the underlying biology doesn't respond to economic incentives at the scale required. 35 years of intervention later, Japan's population is shrinking by more than 500,000 people per year, the equivalent of a mid-sized city disappearing every 12 months, not from war or disease, but from the simple absence of births. Japan now sells more adult diapers annually than baby diapers. The workforce that builds and operates infrastructure is aging out faster than it can be replaced. The programs didn't fail because politicians didn't care. They failed because you cannot legislate a species into reproducing at a rate it has decided, collectively and without coordination, to abandon. The silence after a rocket launch. Not the crowd, not the engines, but the silence after is the silence of demographic data that nobody read at the press conference. Every spacefaring nation is on the same trajectory Japan was in 1990. Some are 10 years behind, some are 20. None have reversed it. South Korea's birth rate is now the lowest ever recorded for any industrialized nation. Germany, Italy, Spain, and China are all below replacement. The United States dropped below replacement over a decade ago and maintained that level only through immigration from nations whose birth rates are themselves falling as they industrialize. The colony that needs 40,000 young people is drawing from a well that is draining, and the drain began before anyone noticed it was happening. The plan to save humanity assumed humanity would keep producing itself. It didn't account for the possibility that the species would voluntarily, quietly, without malice or catastrophe, simply stop reproducing at the rate required to sustain its own civilization, let alone build a second one. That assumption, endless supply of young, healthy, fertile humans, was the foundation of every Mars colonization plan ever written. And that foundation is crumbling faster than any rocket design, any habitat material, any propulsion challenge the engineers are actually working on. Mars is not waiting for better rockets. Mars is waiting for a civilization that is biologically and demographically capable of leaving. That civilization existed 30 years ago. The birth rate is already answering whether it will exist in 30 more. And the answer is not the one the brochures assumed. Physics is patient. Demographics are patient. You are not, and the window doesn't stay open while civilizations figure out they needed to decide sooner.